April is Oral Health Month, and I'm here at Family Dental Center on Gordon Street with Dr. Johal, Dr. Mandeep Johal. Thank you for joining me today.
Thank you for being here.
So we've come up with a little activity to promote this month. Tell me, what are we doing?
We're going to do a little game of truth and false to see how well you know your oral health.
Okay, it's been a shock to everyone. I love going to the dentist. I floss every day. I brush every day. Don't always use the after wash, but yeah, I just love oral care. Is one of my favorite parts of my day.
Oh my God, he's like one of my favorite patients. It's amazing.
Okay, so
are you ready?
This.
Let's
okay,
test your skills.
We got true, we got false. Let me know. Okay, what's the first question?
Okay, so first question.
First question.
True or false? Tooth decay in children has been decreasing over the years.
Decreasing. I will say false.
Okay, why would you say false?
I feel like kids might be getting more candy and like a lot more junk in today's world.
Exactly. You were right. That was really good. Most people actually get that wrong because you think it's 2024 and you think with all the technology and all the promotion of flossing and brushing twice a day, you would think that we would be seeing a decrease in tooth decay in children. And there's actually been studies that have shown that there has been almost a 60 to 70% increase in decay in elementary children. But it's multifactorial for sure, right? You got the pandemic, people weren't going for regular checkups, but also a lot of processed food as well.
And I feel like, a lot of kids, families are like a lot more on the go today. And There's a lot less home cooking and just a lot more of that in the world. So I got one right though. So bad for the kids, good for me.
Yeah, that was actually really good. All right, let's see if we get the next one. Okay, true or false? Pregnant women should be concerned about bleeding gums.
I'll say true.
Okay, that was kind of obvious because I wanted to be obvious.
Well, shouldn't everyone be concerned about bleeding gums?
They should be. And I put this in there not just because the reason I put this in here, honestly, is because I've actually had pregnant women tell me that they were told not to go see the dentist, which is absolutely false. You should be going more frequently to the dentist. Because that's a sign of gum disease, right? But gum disease affects everybody. That's the reason I put this in here. But we should be really talking about the prevalence of gum disease in society today because bleeding gums, let me ask another question. Would you walk around with a cut on your hand?
Hopefully
right?
not.
We would address that, but guess what? There was a survey that was done that showed the majority of patients think when they brush their teeth and spit blood into the sink that it's normal. Right? Just because it's common doesn't mean it's normal. So if you don't mind, can I just share some quick tips?
Sure.
So we already know you should be flossing twice a day, brushing twice a day. But if you do have bleeding gums, you can have simple products that you can use. Like you can use Perio Guard by Colgate with a really good toothbrush. I really like this toothbrush, especially for pregnant women. That's why I really want to spend some time on it because they're avoiding seeing us. A lot of people actually avoid brushing along the gum lines because the gums bleed there. So this is like an ultra soft bristle brush. I wish I would have opened it so you can see it's really soft. So you can be extra gentle around the gums. And it's okay if it bleeds a little bit, but it's going to eventually get stronger and tougher.
It's like it creates a little bit of callus.
Exactly. Right? So you're targeting it localized, but definitely target gum disease systemically as well because that's important as well. But I don't want to get ahead of myself because we're going to talk about that in a bit.
All right. What's our next question?
Okay, next question. True or false? Mouth breathing has no effect on oral health.
Mouth breathing?
Mouth breathing.
I will say false.
It has a huge effect. Mouth breathing has a huge effect.
So that's what I meant. Wait. Yeah,
mouth breathing has no effect.
Yeah, so that's false. So
I had to make it a little tricky. Okay, I had to make it a little tricky.
I have an English degree.
Yes, oh my gosh. But you know what? Yes, it does. Mouth breathing definitely has effect because when you mouth breathe, your mouth dries up and now you're affecting the biome in your mouth. And that can lead to cavities or decreasing the pH in the mouth. Decreasing the pH and changing the biome is what leads to mouth decay, to tooth decay. And the mouth bacteria that you find in the mouth is directly related to the bacteria they're going to find in the gut. They're all connected. So yeah, oh my gosh. That's three out of what? I don't know how many we have, but that's 3 out of 3 so far.
Yes, I'm all about the grades.
Okay.
I miss school. I love the dentist and I miss school.
Oh my gosh, favorite patient ever. Okay, so true or false, your oral health is directly connected to your overall health.
True.
Yes, so a lot of people don't even know this, but diabetes and gum disease are totally connected. Heart disease, diabetes, and gum disease are connected as well. We had osteoporosis, dementia. There's respiratory diseases. People don't know that there's a direct correlation between the two.
And my dog has been sick lately. His vet is just across the way here. And like they always tell me, like, check his gums first. Like if there's something wrong with his gums, there's something wrong with him. So
yeah, because it shows us systemically, right? So if there's inflammation in the body, it's going to show up in your mouth. Your gums are going to bleed. But yeah, I just really wanted to draw that attention to everybody. So when you're going to your dentist, we should be really looking at everything, because even sleep is a main concern for us. So I make sure I address sleep for a lot of our patients as well. I'm not sure if you do, but in our clinic, we make sure we screen all our patients for sleep, because that's directly related to your oral health as well.
All right, what's up next?
Okay, let's see. True or false? The Canadian dental care plan is for all Canadians and is similar to OHIP.
I'm going to say false.
You're right. You know all these things. You're getting all the questions right.
Sorry.
Okay, I'm going to make it harder. But truthfully, I did want to make it easier, so I want people to understand, because we're getting a lot of questions from our patients about this as well. And it's not available to everyone right now. It's available for like a combined income of families that are making less than $90,000. But to get more detailed information, please visit the Canadian website for more details about the Canadian Dental Care Plan. And they are also they also give you like a link to go ahead and start registering. But right now it's mostly for seniors. And then the rollout in end of June is going to be for children under 18. And I am pretty excited about the plan. Dental care should be accessible to everybody.
Yeah.
So hopefully we iron out all the details and it can be accessible to everybody.
Yeah, I mean, like it like you said, like if you had a cut on your finger, you'd want to get help for that. If your gums are bleeding, you want to get help for that, and this is where you go for it.
Well, exactly. And I feel like even having the dental plan right now is just bringing to the front the importance of oral health. And it's the same as your physical health, same as your mental health. So I really feel like the government helped to bring it to the leveling field. Whereas when it wasn't covered at all, people just kind of dismiss their oral health a lot, and because it wasn't covered. Or people had financial means that they couldn't meet, right? So now I am pretty excited.
That's awesome.
Yeah.
All right.
Well, yeah, you did really well.
Oh, was that the whole quiz? Or?
Yeah, that was
that was
it.
the whole quiz? Oh, well, I guess I'm perfect with my oral health. So I don't have to go to a dentist ever again.
Oh, no, you do. You got to come for your regular
Yes,
checkups.
I know.
Please go a minimum twice a year for your regular checkups. And floss twice a day, brush twice a day, and hopefully you only get to go for your cleanings and nothing else.
All right. Well, that was really fun for me. It's great to do well on the test. I haven't been tested in a while. But before we go, how can we find out more about you and what you do here?
Okay, so you can follow me on Instagram at Dr. Mandeep Johal. I have lots of information about teeth, oral health, about sleep, about children's sleep, and I do see babies in my clinic. That's something I feel like a lot of people don't know. I really encourage people to bring babies as early as possible so we can go over oral health concerns. It's not teeth. I know everybody's laughing when they have no teeth, but just not just even cleaning the gums, but just about how they're breathing and sleeping is very important. Because I really do focus a lot on sleep apnea in my clinic. I feel like a lot of people have sleep disorder breathing. So I just like to bring that out there, because I always say sleep disorder breathing doesn't just happen overnight. It starts at birth. So that's why I have this really big interest on that. I do treat all ages, but that's something I'm really passionate about, because who doesn't love babies?
Awesome. So that's we're here at Family Dental Center on Gordon Street. Thank you, Dr. Johal, for joining me today.
Thank you so much for being here.